It's James with the MS Seasoning, here to teach you how the lungs work. You ready? Of course you are. Why else would you click this video? The anatomy and the physiology of the respiratory system really is not that complicated. Well, I say that now, but I remember struggling with it when I was in school. So I wanted to throw together a short video showing you just how simple it can be. Now, today we're just going to look at what normal looks like. If you have any questions about specific diseases or conditions, check out some of our other videos. But with all that out of the way, let's go do what we came here to do and learn about the lungs. So breathing's really broken into two components. There's ventilation, which is the movement of oxygen to the alveoli, and then there's respiration. As that oxygen makes it to the alveoli, it sits there and waits for a red blood cell to pass, where it loads it up and carries it off to the tissue. But we need to back up because, as simple as it is, there's a little bit more to it. Now, it all starts in the diaphragm. In its resting state, it's dome-shaped. You'll see this pop up on a lot of tests. As it contracts, it flattens out and it draws the lungs down there, increasing their size and therefore decreasing the pressure. Since the pressure is less in the lungs than it is in the atmosphere, it draws the air in. And the first thing it comes in contact with are these structures called the nasal concha. Now, their whole purpose for existing is to warm and humidify air. So as air goes in and they hit those concha, it starts to circulate. And as it does that, it picks up moisture and heat before moving to the next part of the airway, the pharynx. Now, the pharynx can be confusing to some students because you'll hear things like the laryngopharynx, the nasopharynx, the oropharynx, the hypopharynx, and it sounds like a whole lot of pieces and parts, but it's really just subsections of the same thing, which is the pharynx. Now, the pharynx is more of a passageway than it is a structure, but it's just a tube at the back of the airway. It runs from the back of the nasal cavity all the way down to the larynx. And the space behind the nasal cavity is called the nasopharynx. The space behind the mouth is called the oropharynx. And everything below that's called the laryngopharynx, or sometimes the hypopharynx. But most textbooks refer to it as the laryngopharynx. Now, up to this point, the digestive tract and the respiratory system have shared a space, and that's the pharynx, because both air and food move through the pharynx. But here's where it divides, and notice how the trachea jets forward, so the air kind of has to turn. Now, under normal conditions, this is negative pressure, so the trachea is actually drawing that air in like a vacuum. Now, why is this important? Well, if you're ever going to be ventilating a patient, we got to remember that normally breathing is driven by negative pressure, so air is being drawn into the correct place. But when we're ventilating a patient, even though the air is moving in the same directions, it's positive pressure, which means there's nothing to guide that air into the trachea. So you have a large amount of air going down the other tube, the esophagus, towards the stomach. So this is why head positioning and airway adjuncts are so critical. Now, as we swallow, the epiglottis closes to prevent any kind of food or liquid from going down the trachea, and it reroutes it down the esophagus. Now, as soon as that air passes the epiglottis, it ends up in the larynx. Now, the larynx deserves a video all on its own. It's very complex. It's full of muscles and cartilage and soft tissue, and it contains structures like the vocal cords, which is how we're able to speak. Now, you can see here that this main tube is actually tied to the larynx, and it's called the trachea. And it has these hard cartilage rings around it to keep it rigid. And if you think about how we breathe, that makes sense because air's drawn into the lungs with negative pressure. And if we didn't have those hard rings, the trachea would collapse. Now, as the air travels down the trachea, we come to yet another fork in the road. And this is called the carina. It likes to pop up on test. And the trachea actually divides into the right and left main stem bronchi. Now, this particular picture doesn't do a good job depicting it, but there's a much harder angle to the left. This is why pneumonias and foreign body airway obstructions normally end up in the right lung. Then the air makes it to these smaller airways called the bronchioles. Now, pay attention to the smooth muscle or that muscle wrapped around the bronchiole. That's because the body can constrict them or dilate them based on the body's demands. And the smooth muscle is covered by these beta 2 receptors. I'll put a video we did on alpha and beta right here. I just wanted to point out that smooth muscle because a lot of our medications and different medical conditions and diseases work on that smooth muscle. But in a normal, healthy adult, it should be open, allowing air to go in and out with ease. Now, this is a good time to point out that inhalation actually happens 2 to 3 times faster than exhalation. So if we have any kind of bronchial constriction, you're going to notice it more on the exhalation than you will on the inspiration. This is why asthma patients complain of having a difficult time breathing out, but not as much of a problem breathing in. But in the healthy adult where the air can pass, it eventually ends up in the alveoli. Now, the alveoli are these grape-like sacs where the oxygen sits and waits for the blood to pass through and pick up the oxygen to carry it to the tissue. This is known as diffusion or external respiration, and it's just the body following the laws of physics. There's a higher concentration of oxygen in the alveoli than there is in the blood, so the oxygen goes from an area of higher concentration to an area of lower concentration. Now, what the books don't always do a good job explaining, and it's important if you're going to learn about conditions like COPD, is that the alveoli actually inflate and deflate with every ventilation. Now that we got the anatomy and physiology of respiratory down, let's jump back and talk a little bit about ventilation.